Welcome. Thank you for taking the time to learn more about the treatment and care for patients with wounds. This wound care video is sponsored by the Opioid Response Network. This curriculum was developed to address the occurrence of wounds in people who use drugs, especially due to Xylazine adulteration of the drug supply.
Xylazine is a potent synthetic sedative that has been found in the opioid supply in street drug markets throughout the United States. Xylazine belongs to a different category of drugs than heroin or fentanyl, and it is typically used by veterinaries as an animal tranquilizer. While xylazine is commonly found as an adulterant in fentanyl, it has been found in other substances as well. Xylazine has other names such as tranq or anestesia de caballo. Xylazine use has been associated with skin wounds at injection sites or other parts of the body. If left untreated, these wounds may lead to limb amputation or sepsis.
The program came about with a phone call. So we received a phone call from an outreach team that said, we need some help. We're doing this community outreach and we're noticing that some of our clients are coming to us with these, pretty horrible wounds. And we would love for you to have your nursing students come out and really help us with, examining the wounds and then seeing what needs to be done so that these individuals, won't have these dire consequences that they were seeing. These clients were having wounds that were infected to the point that was requiring, medical interventions to a point where surgery was required. So what we did is we got a team together of nursing students and we went out and we provided community outreach right on the spot, which included doing a wound assessment and then even caring for the wounds. And then the best part was we taught individuals how to care for their own wounds. So we showed them and demonstrated, and then we left them with a wound care kit. And what we found was surprising, that the individuals were coming back and their wounds were getting better from just the education that we provided and the use of the wound care kits that we were giving out each week. To understand how to treat these wounds, first we are going to review the basics of wound healing and how to identify the various tissue types and drainage that can be found in a wound. Being able to differentiate a healthy, normal wound from a non-healing wound is important in deciding what treatment is needed. The first stage of wound healing is called hemostasis. During this stage, bleeding occurs at the site of injury and then a clot forms. The clot prevents further bleeding and creates a nice barrier to prevent bacteria from entering the wound. The second stage occurs about 10 to 15 minutes after the initial injury, and that is called an inflammatory stage. This is where white blood cells arrive and start to remove bacteria, debris, and damaged tissue at the wound site. Non-healing wounds remain in this inflammatory stage. The third stage is the proliferative stage. And this stage lasts several weeks, and this is where the new tissue is formed. The final stage of wound healing is called the remodeling stage. This stage begins around day 21 and can last for years. During this stage, the tissue becomes more flexible and smooth as it heals. There are different types of tissue found within the wound bed. Two normal and healthy signs of wound healing are the presence of granulation or epithelial tissue. The wound tissue types that indicate a non-healing wound are referred to as slough or necrotic tissue. These tissue types require additional treatment and must be removed in order for the wound to heal properly. Finally, there are different types of drainage that can help indicate overall wound health. The first type is serous, which is clear, watery, and is found in healthy wounds. The next type is called serosanguinous, and it is pink and it's a mixture of plasma and blood, and another sign of normal healing. Sanguinous is that bright red that often occurs right when you have the initial injury and it's that active bleeding. This is also part of the normal healing process. However, if the drainage does not stop, the client needs to seek medical treatment, as this may be a sign of a complication. The last discharge is pus, and that could be yellow, brown, green, or tan in color and is a sign of infection. Pus also presents with an unpleasant odor. If pus is present in a wound, encourage your client to visit a healthcare provider for further evaluation to prevent more severe wound complications. Infected wounds can lead to the formation of abscesses or cellulitis. An abscess is a collection of pus presented as a firm, painful lump that's right underneath the skin. To get rid of an abscess, you can apply warm, moist compresses to the area to allow it to open up and then drain on its own. Cellulitis is a skin infection caused by bacteria that's a little bit deeper underneath the skin. Individuals with cellulitis can present with redness around the area, warmth, swelling, and pain, and fever. Both abscesses and cellulitis can lead to a very deadly condition called sepsis, which is an infection of the blood. Signs of sepsis include fever, shivering, pale skin, a fast, rapid heartbeat, fatigue, and shortness of breath. Sepsis has about a 50% mortality rate and can lead to death within 6 to 7 hours. These symptoms often mimic those of withdrawal. Any clients exhibiting signs of sepsis should seek immediate medical attention due to the severity of this condition. Encouraging patients to seek medical treatment or even accompanying them to see a medical provider at the emergency room can help a client receive life-saving treatment.
Xylazine or other drug-related wounds can heal using basic wound care. First, clean your hands to decrease bacteria entering the wound. If you don't have access to soap or water, hand sanitizer is okay. Wash your hands for 30 seconds. Look at the wound. Identify the tissue type. Look for healthy epithelial or granulation tissue. Or does the wound bed have slough or necrotic tissue? Assess the drainage. Is it clear, pink? These are signs of healing wound beds. Or does the drainage look red? Or does it have a smell and look like pus? Second, rinse the wound to clear debris and dirt. You can wash the wound bed with saline solution or sterile water, preparing it for additional treatment. Third, apply a moisture layer to the wound. For wounds that are dry after cleaning, add moisture like A&D ointment, Vaseline, or if available, Xylaform sheets. All of these forms provide a nurturing environment for the wound to heal. Fourth, cover the wound with an absorptive layer. If the wound has an excess of drainage, thicker absorption layers like an ABD pad or maxi pad might be appropriate. For wounds that have less drainage, gauze or a Band-Aid could be appropriate also. Fifth, the last step is to secure the dressing with Curlex or 3M Coban wrap, ensuring that it's not too tight so that it maintains good blood flow. Look at the border of the pads and ensure that there's no leakage of fluids to the outside. If you peek under the pad and there's no drainage, consider applying more moisture to create an ideal environment for wound healing. Individuals with xylazine or drug-related wounds may prefer to self-manage their wounds and should be educated on these steps as well. Remind individuals that it's important to change the dressing every couple of days to prevent infection and to ensure proper healing. Check for signs of infection, like odor or slough, and encourage medical treatment if necessary. If wounds are infected, encourage your clients to seek appropriate medical treatment and support clients in accessing this additional care. When a wound becomes infected, basic first aid may not be appropriate. Skills like motivational interviewing can help with encouraging medical treatment. Having the tools to best connect your client to further medical treatment is important. So one of the first xylazine wounds I ever encountered was a middle-aged woman with wounds on the backs of both of her hands. She injected into the backs of both, and the wounds were getting worse. They weren't healing. I came into her life with no clue how to heal these. I didn't know what they were at all. And in my trunk, in my car, we just did outreach. It was myself and a peer. So in my trunk, I carried very simple wound care supplies, nothing complicated, nothing really, extensive or expensive. And we proceeded to work with her over the course of about 6 months with very simple wound care. At times we washed it in the sink at the hotel, other times at the Taco Bell. We washed it in a bucket of soap before. But we used Xylaform and an ABD pad and just gauze roll to heal her hands. And it was pretty miraculous.
Now that we've covered all the aspects of a wound, let's summarize. So when you are assessing a wound, first thing you're gonna do is look at the wound. You gotta make a decision. Is it healthy or is it unhealthy? What type of tissue is in that wound bed? Then you're going to look at the moisture of the wound. Is the wound too dry? Is it wet or is it moist? You also want to remember to look at the drainage. Does the drainage have an odor? Is there a large amount of drainage or is there a minimum amount? What color is the drainage? And then lastly, you want to determine the wound treatment. Starting with, how do I clean the wound? Am I using soap and water? Am I using a wound wash? What kind of ointment do I use on top of that wound? What dressing do I use? And finally, how do I secure the dressing to make sure it stays in place? Are we going to use tape or are we going to cover it with a sock? These are all important decisions that need to be made when doing your wound assessment and how you care for these wounds.
Due to stigma, many people who use drugs may have negative experiences with the medical system and may be hesitant to seek medical care. For this reason, it is important to listen and validate their feelings and concerns about seeking care. You're dealing with the whole person, not just a wound. Offering to accompany them or providing a warm handoff to a trusted facility might help ease some of their anxieties around medical care. Remember, always respect your clients and their experiences and lead with a person-centered approach by meeting people where they are. If they're receptive, encourage clients to seek continuous medical help in severe cases to prevent complications. With these steps, you can provide effective, compassionate care and support both wound healing and further interventions for healthy outcomes.
If you are interested in further education on xylazine and wound care, please reach out to the Opioid Response Network for training and technical assistance on wound care at no cost to you. Please submit a request to the Opioid Response Network at the website linked below or by reaching out to orn@aaap.org.